Thank you very much for waiting, everyone. We will now begin session 5, Well-Being, Realizing Inclusive Societies. And now I'd like to invite speakers to come up to the stage. And let me introduce the speakers. The moderator, continuing from session 3, is Ms. Naoko Ueda, head of the OECD Global Relations and Cooperation Tokyo office. The speakers are Ms. Sabine Monique Gimbre, director of the International Office of Amsterdam. Ms. Maria del Pilar Lopez Urbe, Secretary of Economic Development of Bogota. Ms. Maria Luise Aldim, Deputy Mayor of Lisbon. Mr. Godfrey Akmari Atieli, Chief Officer of Nairobi. Mr. Dinesh Dash, Mayor of Southeast District of Singapore. And Mr. Juan Alberto Quezada Garcia, Director of Training and Educational Officer of Zapopan. And now I'll hand the microphone over to Ms. Ueda.
Thank you very much. Now, without further ado, and of course, women, elderly people, and children, the youth are such a core of the society, so we're going to talk about that. And the first speaker will be Ms. Sabine Monique Gimbere from Amsterdam. Thank you.
Thank you so much. I'm going to present on... Is it on? No. Yes? I'm going to present on female empowerment, and I think that this morning's podium of the city leaders showed that we still need a lot of work done when it comes to enhancing women's rights. So on the March 8th, International Women's Day, Amsterdam Mayor Femke Halsema hosted Women Unite, an international conference focusing on women's rights. Why, you may ask? A study spanning 20 countries, published earlier this year by UN Women, found that there's a worrying regression in attitudes towards gender roles across the world. Women are increasingly facing threats of physical violence and intimidation. A troubling backlash seeks to silence them and roll back hard-won rights. Youngsters are particularly vulnerable. Society is faced with an increasing conservatism influenced by social media. It has become commonplace among boys to say that women are lazy, that your wife is your property, and that you are allowed to hit your wife. The internet is full of messages from boys who blindly copy the words and actions of influencers such as Andrew Tate. There is a war on women, and for Amsterdam, it was time to call a spade a spade. Women's rights is a struggle for human rights, one that ultimately affects all people and deeply shapes the societies and the economic and political system in which we live. Half of our population is female, and we cannot afford to leave them behind. However, the conference did not solely focus on women from the perspective of victimhood. By showing the indispensable role of women in society and by showing unity and action, it was truly a celebration of the unstoppable force that women represent across the world. Turkish-British writer Elif Shafak was asked to set the scene. She talked about what it's like to be a woman in today's world, a world in which women have more to lose than men. To quote her, "I think we need to go back to the basics, remember the solidarity, the sisterhood, and expand it, also in being solidarity with the LGBTIQ movement and with other people with different and diverse backgrounds. Under War on Women, Jamila Ribeiro, a Brazilian writer, academic and feminist, addressed the cultural backlash and violence against women from a broader perspective. Violence against women, femicide, are not isolated phenomenon. She addressed how education, housing, labor conditions affect the lives of women. Prominent Dutch women took part in a panel on violence against women. The greatest danger for many women still lies within their own homes, whilst there remains a certain reluctance among the police and support services to intervene in private matters. If there is no other option, the women, with or without the children, are removed from their homes. Amsterdam now tried to change this around by tackling the perpetrators. And so at the conference, the mayor proposed an agenda for the future. Girls everywhere in the world must have access to quality education. Equal pay must be enshrined in law everywhere and enforced by the government. Combating violence against women and femicide, protecting women, must be a priority for every government. Reproductive rights and access to reproductive health care are human rights and must be codified in legislation and policy. A truly public sphere in the cloud should be created in which women participate on an equal footing. All these points will only be realized if women are better represented in politics, not as a favor, but as a right.
20 more seconds.
One concrete step Amsterdam has taken is opening a sexual assault center. To make it easier to report assaults, the center offers professional help to anyone who has had unwanted sexual experience. It doesn't matter whether it happened online or offline, recently or a long time ago. And a broad team of professionals and specialists, including doctors and psychologists and police authorities, are present. And in concluding, also cities should unite, like some have already done in the Change Network. And I know that some of the cities present here today are already participating on it, and Change serves as a platform for knowledge exchange, advocacy, and trust building among cities on gender equity issues. Thank you so much.
Thank you so much, Sabina-san. Thank you. Next, we would like to welcome Ms. Maria de Pilar Lopez from Bogota. Thank you so much.
Thank you. I think if you can. Okay, so I want to talk very quickly about what we're doing in Bogota to actually close gaps, especially for women. So first, a brief introduction about what is Bogota. Bogota is a huge, enormous city, almost 10 million inhabitants. It's an upper middle income city in the middle of Colombia. It's 25% of the GDP, of Colombian GDP, has an economy that is actually bigger than the entire economy of Uruguay, Panama, or Costa Rica. However, it has also enormous problems. Inequality, a lot of heterogeneity among their population is some of the challenges that we have to face every day. And of course, women are in front of this. What type of gender gaps we're actually facing when we talk about productive inclusion as a secretary for economic development? Of course, the main gap that we have is labor force participation, when we actually observe a 23 percentage points of gap between men and women. Also, there is an unemployment rate gap, and this is actually, driven by different reasons. First, the care burden. Second, this is going to lead to some kind of labor or economic exclusion, that is the market effect. And then finally, some kind of like that we observe, subsistent entrepreneurship, which is the forced response to this exclusion. What are we doing? We actually have a pathway to economic autonomy, which is actually something that we promote, productive inclusion. The first part is to actually understand what is the problem. So we need to actually make a good diagnostic of what are the problems in terms of firms or businesses that are run by women, or in terms of the barriers that they actually face when they go to the labor market. So we have developed a tool to actually, in the terms of firms, understand the maturity levels of firms and strategic opportunities for enterprises. And we also have developed a tool in terms of labor market demand survey, which actually allows us to understand skills and futures that firms are demanding right now, and which are the groups that are facing the main barriers to access jobs. Once we understand what the problems are in terms of firms and businesses and in terms of jobs, we actually design a route or a pathway, which we actually call productive inclusion, both for businesses and firms and for those that want to actually get a job in the labor market. This route, it goes from stage 1, the diagnosis, stage 2, training and formalization, stage 3, financing and productive asset grants, and stage 4, market linkages. In terms of labor market, we also have a route, a pathway that they have to follow, those that want to get a job. One is training and skills. The second stage is labor intermediation, and the third stage is job placement. All of this is going to lead us to more economic autonomy through, and this is very important for the Bogotá's government, evidence-driven policies. We actually implement public policies based on evidence that is going to allow people, and in this case, women, to actually get their own income, to overcome poverty traps, and of course, to get resilience to any shocks. This is just briefly what we're doing in terms of the pathway for businesses. So what I was mentioning, it was the diagnosis, which is the tool that businesses have to actually answer a survey. Then we have, depending on the level of maturity, we actually have some programs that are focused or target, depending on the maturity, if it's very basic of birth maturity, or is actually in a growth stage. We have a different program for different stage in all these pathways. Same for access to credit and productive asset grants. We also have a focus, of course, on women. And then finally, market linkages, where we actually focus and give a different alternative depending on the maturity level. So basically, what we're doing is first to get information. So we develop some tools. Second, once the tool is the tool and we get the information. Second is to develop an intervention or a program that is going to give us, all this pathway. And third, we're actually going to target, depending on the level of maturity, in this case businesses, a different program. And finally, we're going to measure with new indicators the results of each of these interventions. We have developed this for women and for other different vulnerable groups. Thanks.
Thank you. Thank you so much, Maria-san. Now, next, we would like to welcome Ms. Maria Luisa from Lisbon for your presentation. Thank you.
Thank you so much. Good afternoon, everyone. Oh, there's my presentation. So I guess this one. Perfect. So I would like to begin with sharing a simple idea that well-being doesn't happen in a vacuum. So it happens, or it doesn't, through the connections that we have. Connections to opportunities, to people, to systems that include us or shut us out. And there is something we are increasingly understanding today, that well-being isn't just a personal resolution, it is really a policy choice. Increasingly, cities are beginning to develop around quality of life, not just economic growth or GDP, but the real lived experience of life. And this is exactly where today TEAM comes in, the realization of inclusive societies. So perhaps the main question is not what is well-being, but rather who is connected and who remains disconnected to the system. Today, I want to explore this through 4 interconnection dimensions: biotechnology, social innovation, Lisbon as a networking city and the use of AI to improve people's lives. Four forces that, when aligned, can turn inclusion into a reality. And let me start with biotechnology, the connection between science and life. Biotechnology is transforming the way we relate to our health. It allows us to monitor our bodies in real time, anticipate risk, and personalize treatments. Telehealth is a good example that is connecting doctors and patients across distance. Wearables connecting data into diagnosis. Personalized medicine connects science to the individual, and increasingly intelligent tools helps us make better sense of the information, not to replace human judgment, of course, but to support earlier, more precise, and more equitable decisions. But there is a fundamental challenge in this. These connections are not universal. When only some have access, we create a new form of exclusion, not from lack of innovation, but from lack of access. In other words, biotechnology only contributes to inclusive societies when connected to everyone, not just a few. And this is where social innovation becomes essential. If biotechnology creates the possibility to connect, social innovation decides who gets in. It builds bridges between technology and real needs, between policy and people, between solutions and local contexts. And today, innovation goes far beyond technology. It includes new governance models like participatory process and citizen engagement. It includes data-driven decision-making. It includes urban experimentation like pilot zones and living labs, and we have those in Lisbon. And it depends on the collaboration across sectors, because inclusive societies are designed with intention, participation, and equity at their core. And this is where we begin to see a powerful intersection between well-being and innovation. For example, when cities designed healthier environments, like car-free areas to reduce stress and pollution, or walkable neighborhoods increase physical activity and social interaction. In Lisbon, we already see this kind of examples in practice, from the transformation of the riverfront into public space to the expansion of cycling infrastructure that prioritize people over cars. And when cities use data responsibly, they can adapt in real life, improving mobility, adjusting infrastructure, and answering people's needs more effectively. Lisbon is also investing in urban data platforms using real-time information to better understand inequality patterns across the city.
30 more seconds.
This is not abstract in a second. This is how innovation directly shapes the quality of life. It increases a powerful feedback loop. Better well-being leads to a greater human potential. Greater human potential drives more innovation. More innovation leads to better policies, and human policies improve well-being again. And because when cities invest in people, they aren't just improving lives, they are expanding what people are able to do and become. And this is where Lisbon becomes, in this third dimension, Lisbon as a networking city, a place where talent, diversity, and ideas meet. At the heart of this ecosystem, we have the Unicorn Factory Lisboa. It is our infrastructure for connection and increasingly for inclusion, not just a space for startups. But more important, it expands who gets the access to these new networks. But open networks to create fairer societies. And when these networks work, innovation spreads. This is why Lisbon has multiple hubs, and why, with a commitment to leave no one behind, initiatives like Innovation for All emerge. I will spread a bit more fast. And this is where the fourth dimension also comes, because when cities can read patterns with AI, we can make exclusion more clearly, identify needs earlier, and assess the more impact objectively. Public policy becomes not more efficient, but more human. And that's what we are looking. That innovation must evolve along capacity building, especially for those that are more most vulnerable, and so that new technologies expand capabilities rather than deepen the ditch. In other words, we turn innovation into inclusion. So bring it all together. Biotechnology creates new ways to connect health. Social innovation ensures those connections are inclusive, and cities like Lisbon provide the environment where those connections grow, intersect, and multiply. And in this core, this is about something very simple: designing systems where no one is left behind. Thank you so much.
Thank you, Maria. Thank you. Now, sorry being a brutal timekeeper. Next, I would like to ask Mr. Godfrey Akmari Atieli from Nairobi.
Thank you. Nairobi City County has been a member of this and has been coming for the GNF for the last 4 years. And this forum serves to meet and discuss how we solve common challenges that face from various angles and all levels, including working levels, staff, senior officials, mayors, and governors. As we are a critical member of the GNET and continue to benefit through this membership, through the lessons we've learned through the 4 years we've been participating. In March 2026, in an effort to advance gender responsiveness, the government of Nairobi, through the governor, His Excellency Sakaja Johnson, approved a 2 paid menstrual health leave day for all women staff working in the city of Nairobi. This makes Nairobi the first East African country that now joins Indonesia, Spain, Japan, Zambia, South Korea, Taiwan, among others, as a policy which is unique because it is a city-led government initiative with a focus on recovering productivity losses rather than just viewing it as time off. So these days are days that our women who work with us, they are allowed 2 days because of the situation, the natural situation they face, and this has helped them increase their productivity. Studies across sub-Saharan Africa indicate that 65 to 80% of women experience menstrual pain, with 10 to 30% reporting severe pain. This, of course, has a reduction on their productivity at their workspace, and more, us as Nairobi County continue to suffer because our women in such days would maybe just show up for work because it was just a work day, but their productivity would be reduced, the discomfort they would face within their peers and colleagues, and this condition was a condition that lowered their esteem, lowered their dignity, and lowered the space within which they work in. When this was announced, when the announcement of this policy was made, the country, Kenya, received it with open arms, and this has really shaped even how now the private sector in Kenya is responding to inclusivity of women, especially by giving them such days, improving the work environment for women so that it is a safer working space that identifies them and dignifies them too. Sorry. Yes.
A casual conversation where the governor of Nairobi County and his cabinet ministers discussed a colleague's menstrual pain led to a fuss in Kenya. Following that conversation, Nairobi County approved a policy granting its women employees 2 paid menstrual leave days monthly.
To avoid this presentism, where you're just there, let's give the ladies 2 days, any of their 2 days consecutive, no questions asked, no forms filled, no letter written, They just alert the immediate supervisor that they'll be taking their 2 days off.
The policy took effect in December, and in February alone, at least 12 women from one county department had already taken the leave. Marion Kapuya, a revenue officer, says the policy is making a difference, but the stigma around menstrual health lingers.
Before I get to a point of like, excuse me, sir, I'm on my periods and I don't feel okay, it is so hard, you understand? Like a conversation, the menstruation conversation, especially when it is a male to female conversation, it is not something that is so easy, or would love it to be in the open.
The move, the county says, is aimed at improving the productivity and well-being of its women employees. Advocates say such policies recognize menstruation as a legitimate workplace health issue for women who are a vital part of the workforce.
If a woman gets severe menstrual pain, she actually ceases to be functional. Some will get vomiting, severe headache, they vomit anything, the diarrhea. Very many need very, very strong analgesic for them, even to be able to be functional.
Thank you. I just wanted to play that just to show and demonstrate that indeed, within our workspaces, within the spaces we work as cities, and just by shaping not just the government policy, but also shaping the private sector policy and improving the workspace, we need to have a more inclusive society that respects the realities of our life and dignifies the women we work around and with. Thank you very much.
Thank you, Godfrey-san. Thank you. Next, we would like to welcome Mr. Dinesh Vasdash from Singapore.
Thank you very much for having me. Before I start, let me just highlight a few points about what it is in Singapore, and maybe just to give you a bit of a context. Singapore is a country of 6 million people and with about 744 square kilometers, which is about a third of the size of Tokyo. And as such, you'll agree with me that it's highly dense, no natural resources, and an island state. And although our GDP is high, it's useful to just highlight that there are challenges that we face, inclusive of the fact that we have an aging population that will be super aged by 2030, which means that 1 in 4 Singaporeans will be above the age of 65 at that point in time. This also means the rising frailty, chronic disease, as well as social isolation among our seniors, and more needs to be done to include them as part of the overall society. Now, of course, there are many opportunities that are there in Singapore as well, particularly given the fact that the elderly population is indeed more educated, active, and digitally savvy, and they want to live well and independently away from hospitals. In fact, Singapore is a blue zone 2.0 country, which means that the average life expectancy in Singapore is almost 85 years. They say the women live longer than men in general, and I think it's true in Singapore, and I can say that from what I see in my family too. But nonetheless, I wanted to just highlight 3 quick policies that we have put in place to allow for that social integration. Firstly, a public health strategy, that's preventative, active aging strategy, as well as our built strategy to allow for more inclusion. Let me start with first the preventative health strategy. We realize that our healthcare costs has increased by almost twofold in the last decade, from about 9 billion in 2018 to about 20 billion Singapore dollars in 2025. Now, and as such, given the way in which the curve is moving as far as expenditure is concerned, the need to therefore move towards preventative health as well as early intervention, and that strategy is known as Healthier SG, where each resident is given a family doctor as the first point of contact where the residents can interact with, and where the residents can go to these doctors not because they are sick, but precisely because they are well, to have conversations with the doctors to decide what else needs to be done, either in terms of chronic healthcare management or preventative health that might be available by way of social interactions and social interventions to allow them to live healthier lives. Secondly, in order to allow our seniors to be actively aging at home, I wanted to just give us a statistic that every isolated senior, particularly in a high-dense environment where you don't quite talk to anyone, you are holed within your flat, is the equivalent of smoking 12 sticks of cigarettes a day. In other words, their healthcare outcomes would not be good by virtue of the fact that their social outcomes are limited. And as such, the government has put in about 800 million Singapore dollars to create active aging centers, which would be within walking distance of our seniors, to allow for them to socially interact with one another. Now, we can understand social isolation primarily because of the fact that many of them at that age will find that many of their friends have also departed, and therefore they have a smaller and a shrinking social circle. Here, I wanted to just highlight that we have our Silver Generation Office, or a series and a network of ambassadors who are really volunteers who will go out, engage our seniors proactively, and encourage them to join the active aging centers. This again prevents social isolation and allow our seniors to be socially connected. The third policy is really that of allowing our urban planning to be a strength as far as Singapore is concerned. And what you see here is quite a beautiful garden with large trees, all of which are man-made or built, not naturally forming. So of course we built the entire city in that particular way. But to allow for world-class parks to form, green spaces, and to allow for seniors to be able to interact and integrate with one another by virtue of creating an environment which is not just built by buildings, but also with green spaces in between. Even our our housing neighborhoods also has sufficient spaces in between for people to interact with one another and to be able to engage one another in the neighborhood and at the convenience of their home. This allows them to live well in their homes and their surroundings, which is why when you look at the Singapore delegation, we are probably younger than our actual ages. But if you give us an opportunity and perhaps over some drinks, I'll tell you my actual age. Thank you very much.
Thank you so much, Dinesh-san. Now, next, we would like to go to Mr. Fan Alberto Quesada Garcia from Japan.
Thank you so much for having us. Good afternoon, everyone. So I come from Zapopan, and Zapopan is part of the Guadalajara metropolitan area. We are the largest city by population with more than 1.5 million people. And we are also home to the largest child population in the western region of Mexico with almost 328,000 children between ages 0 and 14 years old. For over a decade, we have embraced a vision that places children at the center of all decision-making policies. Since 2015, we have implemented La Ciudad de las Niñas y los Niños, or in English, the City of Children, which has been recognized by UNICEF as part of the Child-Friendly Cities initiative. This means that in Zapopan, not a single decision is made without considering its impact on children and the future generations. To make this vision a reality, we have built a coordinated ecosystem across government departments, integrating economic development with the fight against inequality. A key element to our strategy is measuring what truly matters. In 2022, we launched the Child Wellbeing Survey, known as IBIS in Spanish, which is based on UNICEF's 9 dimensions and developed with the support of local university institutions. This tool allows us to understand how children perceive their happiness, safety, health, and education. And today we are proud to say that approximately 9 out of 10 children in Zapopan feel happy both at home and at school. One of our key programs, CIPINA, it's our municipal system that ensures the protection of children's rights, coordinate actions to prevent violence, and guarantee their comprehensive well-being. Also, in the field of education and community development, we have created the Luciérnaga program, or Firefly program, which improves public libraries and transforms them into spaces for learning, creativity, and community interaction. Through mobile libraries, we have brought this opportunity to underserved areas, closing infrastructure gaps and ensuring that no child is left behind. Additionally, we have created spaces like Ingenia, which is a gaming and digital creation center in collaboration with the city of Seoul in South Korea. And it's also the first project of its kind in all of Latin America, where young people can access training into video games, animation, and emerging technologies, connecting them with opportunities in the global digital economy. We also are very proud of our safe and friendly public spaces. This is one of our biggest parks, which is called the Park of the Children. We design and renovate parks with children's participation, ensuring that these spaces reflect their needs and ideas. Programs like Parques Afuera or Safe Pathways improve the safety of routes to schools, creating environments where children can move freely and securely. We also just made a psychological care center for youth because we recognize the importance of mental health. Through centers like Integro, we provide free psychological care for children and youth, promoting environments that listen, supports, and empower them. Finally, this year, we're gonna be the host of the FIFA World Cup 2026, and Zapopan is actually one of the cities that is hosting 5 matches. And we are actually implementing a child safeguarding protocol in collaboration with UNICEF and other local authorities, ensuring that large-scale events also prioritize the protection and well-being of children, leaving a lasting legacy for future generations. In Zapopan, being the city of children is not just a slogan, but it is a way of governing, a commitment to place children at the heart of everything we do, and a vision for building more inclusive, sustainable, and human-centered cities. Thank you so much.
Thank you very much. Thank you. Now, next, we would like to move into the Q&A session quickly, and then starting with Sabina-san. Question to you is, given the agenda, what is the role of the gender policy?
Thank you. Well, gender policy in Amsterdam is part of our more general diversity policy, but because of some of the reasons I mentioned in my presentation, the global cultural backlash against women that I think a lot of us will recognize, but also some terrible incidents that happened in the city. A young girl was killed. We had some terrible rape cases. There was this all of a sudden movement of women to, become part of public space again, and we felt that we needed to step up on gender equality specifically again. And within our gender policy, like Bogota mentioned, economic independence is very important. We were always a country that was applauded for allowing part-time work, but we've seen that with the divorce rate of almost 50%, after divorce, many women, because it's mostly the women that work part-time, end up in poverty and are not able to provide for themselves and their children independently. So yes, where in the past we thought, well, we're doing quite well where it comes to gender equality, we now feel that we need to step up. And one other number I need to mention is that also in the Netherlands, every 8 to 10 days a woman is murdered because of being a woman. So there are many reasons why we feel we need to step up and to protect women properly. Thank you.
Thank you very much, Sabina-san. Now that naturally leads to the next question to Maria from Bogota. As for women, especially for women entrepreneurs, we have witnessed that the difficulty in access to finance as well as the participation to the labor market. Can you elaborate a little bit some concrete examples, agendas, issues to solve, and how you are trying to solve that with your public policies?
Perfect. Well, in terms of financing access, as I was mentioning, there is a pathway, and then one of the stages in this pathway is actually access to credit. We know, I mean, we have the evidence that women access less to the traditional financial system, and that actually when we access to a credit, we pay higher interest rates. Even that we are actually better, payers. What are we doing to address this? Because also there is one word that we haven't mentioned here that is important, which is intersectionality. Women also, we're very heterogeneous within, our group. There are two populations that for us are very important. One's are women, and then the other one is people that are 50 years old and, or above, precisely because our population is also aging. So when we actually combine both women and women that are, 50 years old or more or older, we actually have even more barriers to access a credit. So exactly what we're doing, we are doing two things. First, we're actually working with fintechs. The fintechs actually target a different, a population that are even more vulnerable and poor than the financial system, traditional financial system. What we're doing is that we actually, when we work with them, we actually give them additional information that they include in their algorithm in such a way that they don't penalize women as they usually, as the usual algorithm does. How we do that? We actually, prepare and give financial education to women entrepreneurs. We prepare them to apply to a credit, and we give all this information before applying to the fintechs. So they actually can incorporate this, that they actually have like a preparation when they access to credit. In terms of labor market, I didn't, of course, have time to actually dig into this, but we also have a pathway. So the pathway is training, intermediation, and then the job placement. For women in each of these stages, we also have different things. Reality is that women are more educated than men. In Colombia, women are getting more education than men, but when we jump to the labor market, we all have all these problems. What is happening is that we have horizontal segregation, and we also have the ceiling glass that they're really hard to break. In terms of segregation, horizontal segregation, what we do is that actually we try to give training. We train women in those skills that are actually being demanded by firms and the demand by firms and businesses. So we actually target and open courses and certificates only to women in sectors that are highly demanded, but they have few women. First. Second, in terms of intermediation, we actually have a WhatsApp channel community where we, in real time, we're actually sending all the posts, all the vacancies in a very inclusive language, which is important. We also actually organize job fairs only for women, and we also have vacancies that are exclusive for women, so we actually work a lot with firms in terms of that. And in terms of job placement, I'm going to close with this, we give economic incentive to firms that decide to hire women, and especially if they're women above 50 years old, we give a higher economic incentive.
Thank you. A lot of good examples. Now, next, we would like to move to Maria from Lisbon. You are utilizing the innovation, AI for the innovation, and what about the utilization of the AI for the medical service access?
So AI nowadays is, well, I would say all over, so in every sector, in every industry, so it's quite common. But regarding innovation, and especially in health, it is quite helpful to use it, not only because it will help us to predict, so we have several services and apps popping up just helping to analyze patterns, and without that information and that kind of data, to predict also what kind of health services we need to have in that kind of territory. So it's really helpful for us to not only have them or have that kind of tool, but also to promote companies and entities to develop themselves and in connection with the the public sector and also with the academia to create something else and something new for the public. But also we are looking at this tool for helping hospitals, for instance, to assist people, to get faster assistance, to improve the response. So it's quite common to have it nowadays, not only through the application or the phone, but really in having it in connection with the systems of managing the hospitals and the health systems to have something more efficient in the answers we have it. And also it is quite common as well to connect this innovation to other services, and we talked already in our industries that are using health data to develop also solutions outside health. But somehow we can use it, the information in a more efficient way. And Lisbon is also doing it, and we want to really invest in this connection with the academia to create more companies, more startups, more scale-ups, and also to attract more talent and to keep our own talent in the city, of course. Thank you.
Thank you so much for those inspiring experiences. Now I would like to go to Godfrey-san. You talked about impressive holiday for leaves for menstruate, quite important. But how much is the ratio of taking those holidays from the side of the women?
Thank you. Nairobi has about 19,000 workers. Of these, about 60% are women, meaning they form slightly above 9,500 of our workers are women. Since December, the uptake has been quite high. Every month, an average of 4,000 women are able to take their leave days. And we are hopeful that as more the gender department continues to do sensitization to the women and toning down on stigmatization and how to do it without necessarily being stigmatized, especially where the bosses are men. We are improving on that so that women do not have to feel that when they have taken this day, their bosses or the men who they work with and the colleagues they work with know that exactly this is why they have taken the days. And also I've seen the private sector, especially the big companies, the banks specifically, and the telecoms coming to us to learn about it and how so that they can go and implement it. And above all is that the level of productivity and absenteeism amongst women has greatly reduced since we implemented this 4 months ago, and therefore it's something that we are keen to see it fully implemented as it improves the environment within our working spaces.
Thank you very much. Thank you very much, Godfrey-san. Next, I'd like to go to Dinesh-san. You talked about the how Singapore is tackling with the aging society, and now my question is the burden, how the government is trying to lessen the burden to the family's responsibilities, because this is becoming a critical issue in Japan. So can you inspire us?
Well, firstly, I think we can share notes, and I'm sure I will have lots to learn from Japan. That's about 30% above the age of 65 when I last checked. The strategy, or rather the philosophy that we have taken, is one of the seniors themselves to be self-sufficient from a financial standpoint as much as possible. So often the government will have financial transfers to either their medical account or their central provident fund, which is a pension fund of sorts, to allow them to have financial stability as well. We believe very strongly, as you have highlighted too, that the family is a very important building block, and that is another area that we focus our financial resources towards, inclusive of grants such as the caregiver training grant to allow for caregivers to go for training and for certain financial support to be given to families who are taking care of their seniors within the family. But I wanted to add that beyond both families and individuals, we believe very strongly that we need to have a many helping hands type of an approach to support our seniors. I've highlighted the point about the Silver Generation Ambassadors, which are really volunteers that goes to people's house and to help them. But also we have a lot of philanthropic organizations and people who are ready to step forward to support our seniors, be it at the active aging centers or through the clan associations or elsewhere. And that allows for an added layer of support that we have. So it's multiple rings that we have to support our seniors who are there. Sometimes our families may be a bit exhausted taking care of our seniors, because if they are in nursing homes or if they have very high caregiving needs, it is difficult, and hence the need for some degree of home care services have also been put in place, all of which are discounted according to the financial capability of the families. So if you're earning less, you get more subsidies from the government. There are also respite care facilities that are available where people can place their seniors in respite care so that the caregivers can take a break. Otherwise, it's very taxing on the caregivers, and especially if they have work to do, they have their own children to take care of, it's very taxing for them. So we've got such facilities in place as well. And we also have the ability for the children or caregivers to also support the healthcare needs of their parents by way of transferring money of their own towards these were otherwise kept for themselves, but they could also hand that over to their parents so that the parents can then use that to defray costs, if indeed cost is a problem. So in summary, we look at it in 3 different ways. Firstly, to ensure that there's financial stability and financial capability supporting the seniors, to make sure that our seniors are healthy, and for that, medical as well as other forms of support are given to our seniors, and thirdly, for them to be socially connected and socially viable as well. Thank you.
Thank you very much. Now, lastly, but not least, I would like to come back to Mr. Fon-san from Zapopan. Fon-san from Zapopan. What is the role of the international cooperation for the issue of young and children, youth and children?
Yes, thank you so much. So in Zapopan, we firmly believe that inclusion is one of the most important challenges of any country. So we're very proud to be sharing this panel with other cities that are doing inclusion, real inclusion in their cities. And we also believe that there's no better way to build it than by creating inclusive environments for children who are both our future and our present. We have been collaborating with a lot of countries, local governments in the past 10 years, but also with foundations. And Bogota, we were just talking about right before this panel that we have been collaborating with Bogota and Medellin in Colombia. But one example is Parques Afuera, which is one of the public policies that I talked about, and Firefly program, what they were made with the collaboration of the Bernard Van Lee Foundation and the London School of Economics, actually. That is, they have been helping us with a learning through play methodology, in which children not only learn in schools, but also in their community and in their public libraries and in the environments that they are part of. We right now are also collaborating with Japan through their international cooperation agency, HICA, which we call HICA. We just developed a entrepreneurship program for kids in Zapopan, and we're very proud of it, but also with a lot of other governments, local governments, and we are very, very, very open to be collaborating with anyone else that it's here in GNETS to develop more child-friendly cities, and we believe that it's not only the present but the future of every city. Thank you.
Thank you very much. Again, this has been such rich discussions and good examples and an important task to tackle, but also good examples of efforts to be which has been done. Now, the key phrases which came up to my mind after these discussions is like importance of inclusion, solidarity, unity, connect, and then avoid the isolation, access, evidence-based public policy, mobilizing private sectors by incentivizing them, an importance of innovation, an importance of international cooperation. Of course, that is not sufficing. However, thank you very much for your great, rich experience sharing, and then please give a big applause to these wonderful, excellent speakers. Thank you. Now back to the MC.
Okay, thank you very much. And we will now take a commemorative photo. So could you please line up at the center of the stage, please? Thank you very much. And everyone, could you please give another round of applause to the speakers?